I'm Patricia Hollinger, and I'm a licensed clinical therapist in the state of Maryland, and I worked in a mental health setting for 23 years. And as healthcare providers changed over the years, it became obvious that we had to submit treatment plans to people in an insurance company who had no training in the field that we had to have training in to provide the service. And often it would be denied or only so many sessions provided without the people that were making these decisions ever seeing the patient or having the training to even make a decision about that. My son had an injury when he was working for the Postal Service, and he went to seek treatment and then was told, well, his insurance had been lost. I don't know how that happens. They still didn't explain that. I went to the postmaster and I spent the day there, and I told her that they would find his insurance policy, and they did. I also learned in that process that workman's comps, their primary way of rewarding their employees is for them to deny treatment. In other words, they might be given a bonus or they're rewarded for how much treatment they deny because that saves the company money. That became very antithetical then to my son's ability to get well because he was constantly fighting with a company that wanted to deny treatment because the business model has to be about profit. And that usually, my experience so far has been that's been denying treatment or not giving people preventive treatment up front, or charging people for treatment sometimes it's really not indicated. I don't think any program is going to be perfect because we aren't perfect people. There will be people that find a way to take advantage, but everybody needs to have the right to health care, not just based on your income, what you have or don't have.
I thought it had been impossible until I saw that Vermont made it possible. Well, if Vermont can do it, why not Maryland?
What we did in Vermont helps the people of Vermont, but like I said, it can't just be Vermont. For my family and for many others today, Maryland taking up the charge of winning healthcare as a human right is a moment of hope.
So we say everyone in, nobody out. Healthcare is a human right.
Took back what you stole from me. I took back.
We shouldn't have to worry about what we're going to eat or what we're going to get put out versus our health. Because if we don't have good health, how are we going to maintain?
There's power in people, and I think people need to start realizing that, start waking up, and I think that's happening. I mean, around here, that's really cool stuff. Yeah, that's all I want to say. You know, we can do this, and you can do this. Healthcare is a human right.